morning. Thank you for the opportunity to present today. The topic of my presentation is the trend towards minimally invasive complex abdominal wall reconstruction. Is it worth it? We have no relevant disclosures. A variety of abdominal wall reconstructive techniques have been described over the past few decades, starting with the first anterior component separation by Ramirez in 1990. Most recently, transversus abdominis release was described by Dr. Nowitzki in 2012. With TAR, in a single step, we're able to release the posterior components of the abdominal wall to medialize the edges of the hernia defect back together, thus recreating linea alba and creating a large retromuscular space for mesh placement. Our center would take these principles of open TAR and apply them to laparoscopy in 2015. And then in 2016, we began utilizing the robotic platform. Despite advances in technique and these new technologies, there really were no studies looking at the financial ramifications of open laparoscopic and robotic TAR. Therefore, the purpose of this study was to perform an economic analysis of our abdominal wall reconstructive program before and after we instituted minimally invasive TAR. This was a retrospective review of inpatient hospital costs for consecutive series that utilized the TAR technique. We had 104 patients categorized into two groups. The first group was the pre-MIS group, which included 52 open cases. The second group was post-MIS, which included 5 open cases, 38 laparoscopic cases, and 9 robotic cases. We look at our demographics and perioperative data, we see that there was really no difference in our demographics, although there was a slight trend towards there being higher BMI in the open group. We found that operating room time and PACU time were equivalent, but what we did find was that there was a dramatic decrease in length of stay for the post-MIS group of nearly 4 days. When we look at our defect sizes, we did find that the open group did have, the pre-MIS group did have larger defect sizes. However, the post-MIS group still had large defects on the order of 20 by 10 at minimum. We look at our financial data for total operating room costs. We found that while the MIS group had higher operating room costs of nearly $2,000, the total cost that we saved by transitioning to an MIS platform was upwards of $8,000. So then we performed linear regression to try to tease out this information a little bit more. On this diagram, the beta here is in dollars per units. And so we wanted to look at the predictors of what would increase our hospital costs. And we found that body mass index, for each unit increase in body mass index, we had an increased charge of $306. For each minute of operating room time, we saw that there was $33 charge. And for each hospital day, we found that it was $1,800 more expensive. We then wanted to look at our predictors of length of stay. I don't know what's going on with the screen here. And on this diagram, we found that the predictors of length of stay were age. Okay. I'm told there's a synchronization problem. So the age, operating room time, and estimated, sorry. This is really distracting. We found, when we're looking for the predictors of length of stay, we found that age, defect area, and operating room time were all statistically significant. However, minimally invasive surgery had a negative correlation, meaning that those patients left the hospital sooner. Finally, we performed subgroup analysis of our MIS cases to look at our predictors of length of stay in that cohort. And we found that only operating room time was statistically significant. We then did the same thing for open cases and found that both age and operating room time were statistically significant predictors of length of stay. So in conclusion, despite an increase in operating room supply costs for the pre-MIS group, for the post-MIS group, transition to performing minimally invasive abdominal wall reconstruction has dramatically decreased length of stay and translated into significant cost savings for our hospital. Thank you.